Dr. Epping, in your testimony, you told us about how you're suing the Idaho Medicaid program for its failure to disclose the algorithm that it used to substantially cut recipients' healthcare services. But could you tell the committee more about how your clients even learned about the use of this automated system?
Certainly, Chairman. The Idaho system, when we got started, I think like many other systems around the country, probably still today, was not disclosed to anyone outside of the Idaho agency, so far as I know. And after about a half dozen families had contacted me, scared that their lives would be upended, I figured I would send a letter, which I did, and I got one back from the agency's lawyers saying that the system was a trade secret. So once we knew it was a secret, we had to go from there to file a lawsuit to find out more about what the system was.
So right now we're hearing an awful lot about generative AI tools like ChatGPT. It's all over the news. Everybody's chatting about it. It's a hot topic. The system you're talking about was relatively simple and an older automated system compared to what we're seeing right now. So what are your thoughts on that fact and how it should inform our efforts to set federal AI policy?
Yeah, well, I guess for starters, I mean, black boxes are black boxes no matter how big they get, no matter what's inside of them. And even though the Idaho system was just an Excel spreadsheet, it still ended up taking us a significant amount of time. I think it was many months, possibly a matter of years, to get all of the information on which it was built. So federal AI policy standards and enforcement that are governing use of automated systems and AI are not solving necessarily for the complexity of those systems. They're solving for the harms that they are causing. I don't know that we need new standards for each new technology. I think the same principles that we can apply to protect and prevent some of the things that we've had to litigate in Idaho would apply to more complex systems as well.
So clearly, if I listen to your testimony, you believe that there's just simply not enough transparency. What would you recommend when it comes to holding these platforms more accountable?
Well, what's critical is standards and enforcement that are specific to AI and automated decision-making systems. We have, which we've had to enforce in Idaho through the litigation, we have basic American principles like due process and equal protection that are there. Where our courts struggle and where our agencies still have gaps as far as what they're overseeing is how to apply those in this new context to these automated systems. We know that the litigation in court, I think, is too unwieldy. Although we've done it in Idaho, it's not going to meet the proliferation of these systems. So each agency, so for instance, with the Medicaid program in Idaho, the Centers for Medicare and Medicaid Services should be overseeing programs that are using automated systems like Idaho and making sure that they're complying with standards that are specific to those programs. We already have a lot of jumping off points that can be used to develop those standards. They just need to be put in place and then enforced by these agencies.
Thank you. Dr. Parker, I'm going to have two questions for you. First, some government uses of AI are probably clearly high risk, like when the Department of Homeland Security uses facial recognition technology. On the other hand, there's also some low-risk use of AI, like when the Forest Service classifies tree canopy coverage with machine learning tools. So first question, should testing, auditing, and procurement requirements be different depending on the type of system? And two, how should the federal government decide what is actually high risk and what is low risk?
Thank you for the question, Chairman. There are certainly many types of AI systems, and I think what is getting attention a lot in the press these days are some of the extreme cases. But we want to also encourage the use of AI in the mundane cases because they can improve services for the American people and they can improve efficiencies. And so NIST has come out recently at the direction of Congress with a NIST AI risk management framework. I think evaluating the risks of each each individual use case, is important to have the right governance approach. We don't need onerous regulations and oversight of simple use cases that no one believes are going to harm anyone. And so having that overarching policy that for every use case of AI within the federal government, those agencies step through the NIST AI risk management framework to determine what is the risk level. If it's low, then the steps that are needed in order to make sure it's used safely are much more minimized. If it's more consequential, then of course we do need to have much more oversight. Certainly GAO's accountability framework or the blueprint for the AI Bill of Rights are designed to try to inform how to address some of those high-risk uses.
Thank you, Dr. Parker. You mentioned the Government Accountability Office, so this question's for you, Mr. Arriga. In your testimony, you mentioned how the GAO has created a toolkit to audit the AI system used by government, and that you're piloting that toolkit right now with one agency. So my question for you is, can you tell us more about how the pilot is going, what roadblocks you may be facing, and at this time, would it be feasible for all agencies to use the GAO accountability framework to audit their AI systems? And if not, why?
Thank you, Chairman Peters, for that question. GAO published our AI accountability framework back in the summer of 2021, and it's really a first-of-its-kind blueprint for agencies to consider as they navigate the AI development lifecycle. The basic premise is that if agency can implement practices, entities like GAO can then come afterwards to identify and evaluate those and point out any findings and recommendations there may be needed. Certainly, GAO has a number of ongoing audits using the AI accountability framework, and we're also hearing that other oversight entities are also using the framework itself to conduct their AI evaluations. There are three challenges that particularly, I think, hamper the AI development within the federal government space. One is that while our framework looks at the AI accountability, AI development lifecycle, agency can use more domain-specific guidance. So, for example, the ingredient list for transparency in medical diagnostic may look very different than facial recognition or even autonomous vehicle. We also need policies around the notion of privacy, transparency, and compliance. And then lastly, we certainly need a digital-ready workforce to implement those practices in a way that keeps humans in the loop.
Well, I'm going to be asking everybody in the panel. I'm going to start with you, Mr. Siegel, and then we'll work down the panel. So in terms of AI policy going forward, what would you say from a legislative standpoint, because we're legislators here in Congress, in terms of legislating, what would be the number one item that we should prioritize in terms of thinking about future legislation? And so I'm going to start with you, Mr. Siegel. Just you got a lot. All of you have a lot in your a lot of different issues that you're working with. But number one, for legislating, there are other things we could be doing, regulations and other kinds of policies or norms, et cetera. But from a legislative standpoint, is there something that really stands out to each of you? Mr. Siegel.
Understood, Mr. Chairman. Transparency would be the number one issue from a legislative point of view, enforcing transparency in the use of AI. And I think that if you were to focus legislatively on transparency, that would take care of a host of attendant issues, such as collusion between the government and corporate sector, privacy issues, even potentially pointing the way towards some kind of private data ownership, so that the uses of people's data was something that if they were not at least initially financially staked into, they could at least have some visibility on. So transparency, I think, is where to begin, and from there, that would lead into other related matters.
Thank you. Thank you, Mr. Siegel. Mr. Ho.
Chairman, a number of months ago, Eric Schmidt was asked about how Congress had implemented the recommendations from the National Security Commission on AI. And he was generally quite favorable, but there was one thing he singled out, which is getting technical talent into the federal workforce, which is the predicate for, I think, addressing a range of these issues that we've talked about today. Take procurement. I think the AI Training Act is fantastic, but what I've seen at a number of agencies is that procurement officials say, well, it's the business unit within the agency that has to make this decision, and the business sort of unit says, well, it's really up to the procurement official. And I think what we really need is the kind of blended expertise that brings domain expertise and technical talent together to really be able to protect American values.
Thank you. Dr. Parker?
Thank you, Mr. Chairman. I would say that we're suffering right now from a lack of leadership and a lack of prioritization on these topics. And one, I think, quick way legislatively that could be done to address this is to appoint those chief AI officers at each agency where they are given the responsibility and the resources to oversee the uses of AI and to develop strategies for their use of AI within their agencies with accountability for delivering those and updating them regularly, and to establish a coordination body like a Chief AI Officers Council that is responsible for coordinating these activities across all the federal government with an intent of prioritizing this activity across the federal government, providing that leadership as well. And then they can also work on helping with the workforce issues, I believe, within their agencies by identifying what the needs are and putting those priorities on getting that workforce into the federal government.
Thank you. Mr. Arriga?
Thank you, Chairman. My number one priority, and if you might indulge me in a hyphenated response, one is on disclosure where discretionary decision-making is being impacted. So the use of it, the process, and any redress. But fundamentally, it is the digital-ready workforce that will make such disclosure effective. So I will echo with Dr. Ho's recommendation in terms of developing a federal digital-ready workforce.
Thank you. Mr. Redpack?
Thank you, Chairman. The experts on these systems are the people that the systems make decisions about. I've worked on this litigation in Idaho for 12 years now, almost, and I have worked with agency officials. I've communicated with federal overseers. I've communicated with the courts, but it is time and time again my clients who have been able to spot the most important systemic problems with these systems. And I appreciate the opportunity to testify to the committee today. The people that the committee especially should hear from and the policies that the Congress should put in place should make sure that at each step in the development and selection of these systems, the people who they make decisions about are included in it. My clients, people with disabilities in Idaho often use the phrase, nothing about us without us, and that is critical in these automated decision-making systems and AI systems. Thank you.